searching for a cure for HIV. Coming up, we're going to speak with an expert right here about the major breakthrough by some scientists while they were testing mice and why humans could be next. You're streaming CBSN Los Angeles. A cure for HIV was tough to imagine just a couple of years ago, but now a breakthrough. New research is shaking up the science community and giving hope to the millions affected by the disease. Joining me now is Dr. Radhakrishna. Welcome, thank you for being here. The fact that HIV infects 37 million people worldwide. First, this has been, we're talking about a breakthrough they made with mice, but people have been cured before. Tell me about that.
Thank you for having me first. And yes, there have been two case reports, one from Germany and one from England. And these were people who got a stem cell transplant for cancers, not for HIV. But while they were doing the transplant, they made sure that there was a certain deficiency in the donor that prevented the virus from docking on. And those two patients have been cured.
Okay, what about this breakthrough with mice? This is about a gene editing tool that they now have?
Yes, so these baby mice were infected with HIV. They were given medications to minimize the viral load. And once the viral load was minimum, then they sent this gene editing tool in there, which went and cut off those pieces of virus that they could find. And 2 out of 7 mice have been cured.
Well, what should people understand today about HIV? There's already a drug out there that, does it just suppress it? Or tell me about that.
Well, right now, HIV has come a long way compared to what it was in the 1980s when people were dying, and it was like a death sentence once they found out. Now, HIV has a chance of having a normal life expectancy. Of course, nobody wants to get infected, but if they are, you take medications, and nowadays we have many single pill regimens which have multiple drugs in that one pill. Very little toxicity, take it 1 pill once a day, sometimes no diet restrictions, and then go about your life just like you would normally. And these people have undetectable viral loads, it is suppressed, and they have very good life expectancy, good enough to get health insurance and life insurance.
Wow, and doctor, you told me an interesting fact right before we came on with this interview. If they're taking the drug, they can't transmit the disease. That's huge.
Yes, yes. And you know, it's also the onus on the person who's infected that they don't cause harm to other people. So undetectable is untransmissible. The U equals U still holds. And so we can cut down and maybe hopefully eradicate this epidemic.
And see what happens now with this gene editing tool that you now have at your disposal. So
yes, it has to move from mice to humans, but it's exciting.
It's exciting. Thank you.
Thank
Dr. Radhakrishna with us. I hope you come back and we'll talk about more, hopefully, breakthroughs and miracles. So
very soon. Yes, I'm looking forward to it.
Thank you so much.